Now we're just doing this basically to improve how patients view X-rays. That's how students view X-rays. Okay. And here we'll be looking at the X-ray view of a hip, and this hip is containing a metal shaft. How will it look like? That's what we're trying to pinpoint. So X-ray view of the hip, and the hip is containing a metal shaft. That's basically hip replacement. So let's just quickly talk about it. So it's usually refers to radiograph, and they are taken after orthopedic surgery. So you have done the surgery already. You're just trying to follow up with the patient, monitor them to see that everything is going well. So things like hip replacement, internal fixation, you understand? So what will you see? Observe for the hip anatomy. That's a pelvis. If acetabulum is there, the femoral head, neck, it could be on one side, so you have to observe it both on the left and the right. Okay. So the metal shaft usually appears as a bright white structure because metal is highly radiopaque. The surrounding bone is visible in shades of gray, showing how the implants integrate to the bone. So soft tissues, they are less distinct, do you understand? But depends on probably if you use a contrast or not. So context. You do all these imagings when you have done a hip replacement, that's arthroplasty, or if there's a fracture fixation. So you want to look at how the thing is healing and how everything you use for fixing the fracture is going. The post-operative imagings, where X-rays confirm correct positioning of the implant and checks for complications. Why is this important? It ensures that the implant is properly aligned, and it dictates any complications very early. It provides a baseline image for future follow-up comparison. So what you see on the imaging depend on what you be observing the patient for, in the next time that he comes to the hospital for a visit.